Hi there, welcome to our recording from SRUK. Today I'm doing an interview with some of the team who've been involved in the registry. My name's Jill Will, I'm the healthcare specialist with Scleroderma and Raynaud UK, and I'll just allow others to introduce themselves. Fatima, do you want to go next?
Yeah. So I'm Fatima Suleiman and I am head of research at SRUK.
Super.
And
Mithi, do you want to jump in?
yeah, sure. I'm Mithi Ahmed Richards, and I am a patient advocate and lived experience advisor for SRUK. I've had scleroderma for 15 years, coming up to 16. And yeah, I've been looking forward to being involved in the registry and been working closely with Fatima and the team in building it.
Great, thank you so much. So we're going to start at the very beginning because lots of people might not have heard of a patient registry. So Fatima, can you tell us firstly what problem the patient registry is trying to solve?
So we're actually trying to solve quite a few problems by having a patient registry. Um, One of the difficulties that everyone will be aware of is that at the moment we still operate on estimates for how many people have scleroderma, and that includes systemic sclerosis, or localized scleroderma, and also Raynaud's. So by having a patient registry, which will allow us to actually get more concrete numbers on how many people have these conditions and also where they're located within the UK, then we have something much more tangible to work with. So that's one aspect. Another thing that we're trying to solve with the patient registry is we're trying to understand how people's conditions change or if they don't change over time. And a patient registry collects data over time. And so that will give us quite a good indication of what are the patterns that some people might be experiencing as their conditions progress. Um, and then there are other problems that we don't know about, but by having a patient registry, which is essentially a collection of data from a community of people living with a specific condition, by having that, then we have this rich amount of data that can actually be interrogated to answer several different questions. And that is something that would be really important and valuable for research and ultimately for impacting people's lives.
Brilliant, thank you. The next question I have for you, Fatima, is just how would the patient registry help? What kind of thing would it involve? What does it look like?
So the SRUK patient registry is going to focus right now on collecting patient-reported outcomes. And what that essentially means is we are collecting your experiences of your condition. So for example, the fatigue that you experience, the pain that you experience, your quality of life, side effects around medications, things like that. What we're trying to capture is your experience in a sense. Um, and that's something that's new. Most patient registries actually collect clinical data, which is our plan for further down the line. But very few of them, to my knowledge, none of them really actually collect the experience from a person living with the condition. So by doing that, what we're trying to do is actually show how somebody's experience of their condition changes over time. And that includes, for example, how they experience, again, the progression of their condition. Um, and it's valuable data because nobody we will add it, and ultimately we will add clinical data into that mix to provide a more holistic picture. But ultimately, nobody knows your condition better than you do. And this is a data point or a data insight point that actually has been missing for other conditions. And at SRUK, we're very patient focused. We really want to keep people with the condition at the heart of everything we do, and that includes in research and in data collection. And so it makes sense for us to collect experiences over time.
Thank you, Fatima. And I guess some people might be wondering what the difference is between putting something into a patient registry or telling their specialist, so that might be their rheumatologist, for example, what's going on for them. There might be an assumption that the data is already collected when the doctor takes notes during a consultation. Is that not the case?
I mean, I think that is the case, but obviously that will vary across the regions and across depending on the care that people receive. What the patient registry, the SRUK patient registry will do is that it will have a set series of questions to create a much more consistent data set. So we will be asking everybody the same set of questions. And that will allow us to then pick up and define and understand different patterns. Because if everybody's being asked different questions about their experiences and it's not being collected in a central place, then that's very tricky to use that data for any kind of large analysis. And it's really hard to get any insight from that data. And ultimately, what we want is insight that is going to improve the lives of people, quality of life. And so everybody gets asked the same question and it's all collected in the same place. So that means then that we have this large data set that has consistent data points across individuals. And that means then that we can start to pick out patterns and identify potential points of interest over time. I mean, the thing that I should make clear that it doesn't do is it doesn't replace going to your doctor and telling your doctor how you feel. This is not like a medical record. It's a research tool, essentially. And it's a research tool that we think is going to be really important in order to provide real life impact.
It sounds really exciting. And I know you mentioned other conditions having something like a patient registry already. What kind of things have they been able to achieve because of their patient registry?
So cystic fibrosis has what is considered the gold standard of patient registries, and theirs pulls in clinical data. So for one thing, they have a very concrete number of how many people in the UK live with cystic fibrosis. Because they are pulling in clinical data and they can see what percentage of people experience what, it's allowed them to do advocacy for drugs. I don't know if anybody remembers quite a few years ago, pre-COVID, which feels like ages ago, they were in the news quite often because they were campaigning for the NHS to sell a very important drug for cystic fibrosis. And the reason why they knew that that drug was important for many of their members of their community is because they had the patient registry. So that's one thing that it does. I mean, and for us as well, you know, one of the other things that we really want to understand is access to care. We know that across the UK, there are regions that have an inequity of access to care. And if we have like data, if we understand how many people have the condition, we understand where they live, then that will help us identify hotspots across the UK. And that will help us with our policy and advocacy work. Because inequity to care is, again, really, really important, if not the most important. We can get the research in, we can get the treatments produced by pharma companies, but if there's an inequity in access, if people aren't able to access that, then it's all for nothing. Which sounds quite extreme, but a patient registry will allow us to do that and allow us to get ahead of the curve on that as well. And that's what we saw demonstrated by Cystic Fibrosis Trust a few years ago. Multiple sclerosis also have a registry as well, pulling in clinical data, and they use it for similar things as well. There's a lot of influential research that has been done that's been able to help identify potential causes of multiple sclerosis. Also work around progression of the condition because it is a progressive onset condition. And so we're hoping for something similar.
That sounds like there are so many possibilities and actually some things that we can't necessarily forecast or expect, but might come out of it Brilliant. So, although I can tell already that this is a super exciting project, my next question might sound a bit strange. I'm going to come to you, Mithi, and just ask what made you want to get involved in the patient registry?
So there's two reasons. The first one is a little bit selfish, if I may add that. So it's actually an opportunity for me to have like an everlasting impact on other scleroderma patients. I've lived with scleroderma for 15 years, as I mentioned, and I've seen a lot of progression and changes in my symptoms, good and bad. And I feel like it's really important to be able to reflect that in some way and to try and use that to help other people. And this was an amazing opportunity to do that because, as Fatima mentioned, it's a progressive illness and there's so many changes and so many symptoms to consider. So there's a bit of a selfish bit there and being involved and having that impact on other people's lives. But also, I think everyone who's watching this will agree that a registry for scleroderma and Raynaud's is well overdue. It's been something that people have talked about. It's been something that I think people need in some sort of capacity, even if they've not known that it's a registry that can provide that, and to be able to contribute towards that and make it as effective as possible so that it has that long-term standing amongst patients and clinicians. That's also a great opportunity for me as well.
Brilliant. And you spoke there about the opportunity to really shape that. So I don't know if you can think of an example or two where your involvement or involvement of other people with lived experience, what that involvement has looked like, how it has shaped what the registry is going to look like. Yeah, what's different because you've been involved, I guess.
Yes, so first of all, I just want to give SRUK a massive shout out because they've not just made a registry, they've made a really patient-centric registry. And by inviting myself and Edith, who was the other lived experience advisor on the panel and the committee, really made sure that we could shape it in a way that was readable and understandable to patients. So SRUK invited us to all the meetings that the clinicians, the researchers and their team were involved in. So it wasn't as if we were just asked to look at a couple of questions and that was it. We've actually been included in the entire planning process and reviewing all the questions and being able to really critique and provide feedback on everything in the same capacity as the researchers and clinicians who are going to be using the registry. So I think that is a massive bonus because it's not just ticking a box by having us included. We actually are the stakeholders and people who can have that impact. When it comes to the actual questions, like I say, we got a chance to look at all of the questions, and myself and Edith, one of the biggest things for me and one of the biggest things for her was making sure that patients can actually understand the questions they're being asked, that they're clear, that they're not ambiguous or vague, because I think in scleroderma and Raynaud's, we already have a lot of confusion around our medical condition. As we've talked about, it progresses, it changes. Sometimes we have one diagnosis, the next day we have another diagnosis, and that can cause a lot of confusion even for patients. So when they're answering those questions, they might not necessarily know how to answer it or what the best answer is. So we've helped SRUK make sure that those questions are clear, that they have definitions, and that they kind of guide the patient to the answer that SRUK are looking for. We've also helped make sure that it's not too tiring because people are going to be filling this out quite regularly. And we don't want them to feel fatigued and tired and fed up and then disengaged from it after about 3 or 6 months. So we've helped SRUK and the panel make sure that the questions are easy to fill out, clear to fill out, don't require a huge amount of time, and also are accessible as well. So patients have different ways of, being able to read it and define things and understand things. So that's just a couple of ways that we've done it.
Brilliant, thanks so much. And I think there's something there that you've touched on about the time involvement and the commitment, I guess, around that. So I think, am I right, Fatima, in saying the first kind of run through of the registry, when someone completes that, it would take them around 15 minutes? But then going forward, they wouldn't have to input absolutely everything again, because they would be invited every 3 months to do an update. So it would just kind of more be changes. Is that right? And
Yeah.
my understanding of it.
Absolutely. So how we're doing this is we're doing a phase 1, which is what we're calling like the proof of concept phase, and this will take place over a year. So essentially, you will be invited to fill out an initial questionnaire that will take you 15 minutes to do. It shouldn't take longer than that. And then every 3 months, we will email you with a unique link to update your data. And the questionnaire that we will send you to update will be half the time. So it shouldn't take more than 7 minutes max, because we won't be asking you to update everything. We just want to know how your condition is. How are you feeling about your condition? Has your fatigue, for example, increased? Has it decreased? Are you in more pain than you were before? Are you having difficulty swallowing that you didn't have before? So that will then happen every 3 months for a year. So within a year, you will be doing some very elementary calculations in my head. You will essentially fill this out 4 times over the year. And it is really important that you, when we get in touch to ask you to update and to fill it out, that you do so, because that will give us then 4 data points over a year. And that is what we would then turn to and say, this concept works. 1, people want to fill it in. 2, we are starting to build a picture over the course of a year of what is happening, and therefore this works. And this will help us then create a case for support for actually doing phase 2. And in phase 2, we will be building a proper patient registry platform. And this, one of the benefits of that is it will be much bigger. It'll be able to hold bigger sets of data. And you will then be able to access your own data. So you'll have a unique login, you'll be able to go in and you'll be able to see actually what you have put in over time. So if you want to know actually what has been the record over the last year, you will then at that point be able to go in and do that. Unfortunately, that's not something we can do during phase 1. Purely because of the way that it's set up to prove that the concept works. But in phase 2, that should be something that happens. But we can't get to a phase 2 if we don't complete phase 1. And in order to complete phase 1, it is really important that people update every 3 months. The other thing I should also say is that this is all going to be data. SRUK is the data controller. We have all of the appropriate cybersecurity protocols in place. We take data governance and data security extremely seriously. And so you can be confident that your data is being held in a completely secure environment. And that is something that we've taken quite a few pains to sort of set out before we actually embark on this and go live with phase 1.
Brilliant. And phase 1, going from a conversation we had earlier this week, phase 1 will be starting by the end of summer.
Yes.
Is that right? Yeah, super. So if somebody's watching this right now and they think, this sounds amazing, I want to be part of it, what can they do next, Fatima?
What they can do next is actually either get in touch with us via our website or go to our website where there should be a page about the patient registry and register your details. And then once the phase 1 is live, we will get in touch with you to let you know, and you'll be able to fill in that first initial questionnaire.
It's almost like a ticket pre-sale then. They can get signed up so they're first to hear and first to get their daytime when it goes live. That sounds really exciting. So I have one final question for you both. If we were to fast forward to 5 years from now, what do you hope to be able to say that the patient registry has achieved? Fatima, do you want to go first?
Ooh, yeah, so 5 years from now, 5 years from now, I want to be able to say that the patient registry is the first of its kind that has a holistic picture of what somebody is experiencing. So that means we don't just have their reported data, as in their experience and how they're experiencing their condition, but we also have the clinical data. So we've got 2 halves of the same coin, essentially. And that means then we have an extremely powerful data set over time. So that data, a period of 5 years, I would really hope that in 5 years' time, we're at a point where we can say, actually, now we can pinpoint triggers, for example. we can see somebody's condition progressing from Raynaud's into scleroderma or systemic sclerosis. We can see some people's systemic sclerosis progress faster and some people's progress much, much slower and stabilize over time. And when we do that, then we can try to pick out why this is happening. And that would then also help us identify treatments or interventions. One of the things I'm particularly keen on us finding are earlier diagnosis, earlier detection interventions. But if we can't detect people earlier, it's really hard then to actually know what treatment to give them. So if we have a patient registry where we're actually able to identify people who are at an early point in their diagnosis, then we could be able to then, invite people to research studies or clinical trials. So that's what I'm hoping, is that in 5 years' time, this will represent a step change, and we'll be pushing the needle much further on the dial than we have before.
Amazing. You've covered so much there, Fatima. Mithi, from
Excited.
your, I know, absolutely, absolutely. It's a super exciting thing, isn't it? So Mithi, I'm just going to repeat the question for you, and see if there's anything else that you would maybe want to add to that. So if we're to fast forward 5 years' time from now, what do you hope that the patient registry will have achieved?
I think that Fatima has beautifully covered everything that I also hope it could achieve. However, there was one thing that she said, and it was the why. For scleroderma patients, including myself, even to this day, I still don't know why I have this condition. I still don't know why I have certain symptoms. I still don't know why I was really unwell at one point, and knock on wood, I'm much better now. There's a lot of questions there. And as Fatima has described, that a registry like this could help pinpoint triggers, could pinpoint changes in somebody's health that might be making them worse or might be making them better, might be helping to find patterns in patients experiencing the same thing, and where that might have come from. And I think that could answer a lot of questions for patients. And that can then lead into those studies, those research articles, those publications that answer a lot of those questions. I think a lot of scleroderma patients know what treatments are available to them right now. Not everyone, but a lot of them do. And a lot of scleroderma and Raynaud's patients are in trials and are getting involved in trials, but we still don't always know what's happening at the beginning and why things are happening. So I think the registry will definitely help provide that, but also on the end kind of scale of that, it's seeing more funding going into systemic sclerosis research and Raynaud's research, because we definitely don't see the same amount of attention on our medical condition as so many other illnesses that exist around the world. And it is what's described as a rare disease. So having a registry is going to really shine a spotlight on the problems that we're facing, that it's extremely serious and life-threatening. And hopefully then we can see more funding, we can see more pharmaceutical companies and institutions wanting to get involved in research and use that data to hopefully find a cure for all of us in the future. So yeah, I'm wishing everyone in the registry panel and SRUK all the best, and thanking them from the deepest pits of my heart for doing this, because we really appreciate it and we can't wait to see it succeed.
Thanks so much, Mithi. Actually, you've just said what I was going to, so I think we can probably leave it there. But just to say, wherever you're watching this now, there should be some information alongside about how you can get involved, or if you've got a question, where you can post that too. So thank you very much for watching, and thank you both very much for coming and giving us the potted history of the patient registry for SRUK. We can't wait to see it alive and kicking for everyone. So thank you very much.